Hi there. Well, wow, I'm getting so many inquiries about eyes at the moment. I thought it'd be really helpful for me to put into a video, what these inquiries are about, what are your treatment options, things for you to consider when you're treating the under eye. So I'm going to try and split this up because otherwise it's going to get a little bit convoluted. First things first, let's talk skin condition. Your under eye has very delicate skin, so does your upper eyelid as well, which is why if you are over 30 and you are not yet using a good eye cream, well, that's where you need to start. You need to start in thinking, how do you have smooth and hydrated skin in that area? Also, how do you get some active cosmeceutical ingredients to the skin in order that it's nice and firm, we have as much collagen in there as possible, and it's feeling nice and tight as well, because any laxity in the upper eyelid, that's a big concern. Upper eyelid is a really difficult area to treat. Ultimately, when people come to me in clinic and say, what are my options, Nofie? I end up giving them the name of the Face and Eye Clinic in Northern, which do terrific operations to the under and the upper eye area in order to improve skin laxity. So that tends to be people kind of 40, 50 plus. If you are younger, obviously that would be a little bit too premature for you. Good eye cream is a great place to start. Or for some people, they will say, oh no, I feel like I have an eye bag. I either have darkness under the eye. Now that's a little bit different to lack of volume. If you have a lack of volume underneath the eye, you can use dermal filler, and oh my gosh, it absolutely has to be the right type of dermal filler. It has to be a person who understands how to undertreat an eye as opposed to overtreat an eye, and somebody who can do a clinical assessment to absolutely make sure it is the under eye, because more often than not, if you can take a photo from the side, and I don't often look at myself from the side, so God help what you're going to see now, but hopefully this will help. You can perhaps see with me, I have the positive vector, so you can see that I have my eye and then my cheek comes out a little bit more underneath. If you are somebody who has a lower body weight than me, for instance, or you have noticed a little bit of flattening of that fat pad, a little bit of descent in the fat pad in that area, you are going to get a negative vector. And as you can see from a negative vector, look how it pulls the eye down the face. So actually, if you are one of these patients, it would be completely inappropriate to start with doing your tear trough. You must start with giving a little bit more mid-face support here. And then I know I'm exaggerating it, but can you see what happens when I give some mid-face support there? You can see how that eye bag shortens a little bit, it lifts, and it looks far more impressive than having something that is flat and coming down your face there. That's very attractive, isn't it? But yeah, hopefully you can see the point that I'm trying to make. I went to a lecture where they had some ocular surgeons saying in some of their blephs that they are doing, they're finding dermal filler that is lasting 10 years in this area, which is why if you are going to consider a dermal filler treatment to the area, it really has to be one of the smoothest, one of the softest products out there. It has to be used in very small volumes, either with the needle placed expertly in very particular places, or if there's a large scale volumization, then we can use a cannula to kind of wash the area to kind of get more support. It must be deep placement. You must understand the risk of treating people who are Asian and black, with the especially with the Tyndall effect, or people who have pigmentation underneath the eye. There are certain brands of filler that will make the pigmentation look more severe. So you must know your onions, basically. I am getting quite a few people knocking on the door asking me to assist with reversals at the moment. Reversing the under eye is not as straightforward, if I can use that word, as reversing the lips. So this is why I approach reversing this area with caution, because sometimes you can lose some of the hyaluronic acid in the surrounding tissue. You can end up needing to wait months, I'm talking 4, 5, 6 months, in order to kind of rebuild that area, and you may need to volumize the mid-face before you can even consider the tear trough at that point. It may not have been the first point you started at. Okay, so I hope that helps. In summary, look after your eyes. So use a good eye cream, use sunscreen, well worth looking after it. If you are over 40, you should be on a retinol eye cream. Ask me about it. I'll give you some great recommendations of stuff that's out there. If you are 20, 30, 40, 50, you're noting some volume loss, that's fine. The older you are, the harder it becomes to counteract that volume loss, because you may get left with crinkly and baggy skin, that kind of crepey skin that can just look a little bit puffy. If that's the case, I will focus on skin issues with you first before we even think about dermal filler. And if you have had an unfortunate result with dermal fillers where you either have been over volumized, best thing you can do, get back to your injector. Your injector should have the skills in order to reverse that for you. That should be something they're able to deal with. If not, there are many people out there who are experiencing managing those complications. So don't lose faith. Okay, looking forward to talking to you soon. Bye.